The statin has been around since 1978.
Mm.
We have lowered cholesterol drastically. It does a really good job in lowering cholesterol. But does it have effect on lowering the heart attack?
Mm.
No,
No.
zero. Because when you take a statin drug, it leaches your CoQ10, and
Yeah.
CoQ10 is a vitamin for the heart. It is makes the heart very, very versatile. Very again, I think the contraction and relaxation is the function of heart. And when you have statin drugs, your CoQ10 depletes, and you don't
Yeah.
get that contraction proper and relaxation. So it becomes a wonderful heart tonic, CoQ10.
Welcome, everyone. Episode 195 of the Healthy Habit Podcast. I'm your host, Dr. Dayan of Healthy Habit Medical Center, located right inside Healthy Habit Health Foods. Today's highlight will be on cardiovascular health. How prevalent is heart disease today? It's often called the silent killer. What are some signs we should be paying attention to before it's too late? And no one better to help us navigate this terrain than Dr. Virender Sodhi, naturopathic doctor and Ayurvedic MD as well, internationally respected Ayurvedic and naturopathic physician, who's credited with evolving the understanding of Ayurvedic herbal medicine in the West. Dr. Sodhi became an Ayurvedic doctor in 1980 and worked as Ayurvedic medical professor until 86, before becoming the first Ayurvedic and naturopathic physician in the United States in 1988. He's credited with founding Ayush Herbs and bringing Ayurvedic herbs to the United States, and his experience with Ayurvedic and naturopathic medicines has resulted in extensive lecturing worldwide on these subjects. And he's the author of Ayurvedic Herbs, the comprehensive resource for Ayurvedic healing solutions. Dr. Sodhi currently practices at the Ayurvedic and Naturopathic Medical Clinic in Bellevue, Washington, with a focus on oncology. And I'm excited to welcome you back to the program here, Dr. Sodhi. How are you doing?
Wonderful. Thank you for having me on the show again. I think you forget to tell me my second book, Free Medicine, Your Body and Natural Pharmacy,
Oh,
is
there we go.
available on Amazon. And people are already liking it. It's a small read, I didn't want to make a big, thick book, but it's just telling that the healing process is inside us. And what we need to do is just provide those kind of nutrient from the mother nature, the fresh air, sunlight, eating right kind of food according to season. You are prone to be healthier. You just look at, you're blessed to be healthier. That's what it is. So we have the blessing, but we have to do the right things for it.
Well, we're blessed to have you back on the Healthy Habit Podcast, Dr. Sodhi. Last time you were on was episode 191, and we did highlight in that, thanks for reminding me, the Free
Yeah.
Medicine, Your Body and Natural Pharmacy.
That's it.
Dr. Sodhi's brand new book. Like he said, you can get that on Amazon. We also highlighted men's health in that episode. I highly recommend that for all the fellas watching this program. We hit on the Ayush Herbs prostate formula. We hit on IU Test, which is a natural testosterone supportive formula. And even saffron has been included into that formula, which is not many people have that on the radar for men's health. So that was a really good episode in 191. So again, thank you for re-highlighting your book, the new one there. So tell us about, number one killer in America, in the Western world really, is heart disease, strokes, heart attacks, high blood pressure. I'm sure you've seen this many times over your career. I have patients on 2 or 3 blood pressure medications. Have you seen that?
Yes. Yeah, it's many patients will come to me with bags of medicine, taking actually not uncommon for me to see 4 to 5 drugs for
There you
just
go.
controlling the blood pressure. First they start on diuretic, then they go to beta blocker, then they go to calcium channel blocker, ACE inhibitors, and then if that doesn't control, then they go to more harder like colonidine and all those kind of stuff. Basically, it does not solve the problem. If
Yeah.
there's a very interesting data available on that too, and I think that's been pulled out, that people who were taking blood pressure pills were dying more faster than people who were not taking blood pressure pills. I think skipping the malignant hypertension, which is very dangerous, but the mild to moderate blood pressure can be easily controlled by the body's ability to heal it. Because if your endothelial muscles are working perfectly for you, and which comes from eating again good healthy food, doing breathing exercise, relaxing your system, having a good gut laugh with your family and friends, and having a good sleep and at night, not in the daytime, then you have a not your blood pressure will be very normal. So yes, heart disease is the number one killer, and we have a wonderful tool for that, statins, isn't it? The statin has been around since 1978.
Mm.
We have lowered cholesterol drastically. It does a really good job in lowering cholesterol, but does it have effect on lowering the heart attack?
Mm.
No,
No.
zero.
Mm.
So look at, when I was in medical school, still 43% people were dying with heart attack. Now it's still 43% people are dying with heart attack. So if it that has made a big dent, we should see a 10, 20, 30,
Right.
40% reduction in the heart. Is a just a common sense, and the in 2023, there is a meta-analysis been published. They looked at all the studies published, and they found out that if you take cholesterol medicine statins all your life, you extend 1 day extra in your life,
Wow.
and 0.08% reduction in heart attack and 1.2 reduction in the stroke. So like nothing, negligible. And plus 60% people will get diabetes. It make people insulin resistant. And also 21% people get muscular pains and aches and pains. And not to mention all the fat soluble vitamins, vitamin A, D, A, K, all those good things for us also going to deplete, and it's
Yeah.
also deplete CoQ10, which which is we are taught in our naturopathic schools, and now actually enlightened cardiologists also saying, okay, if you are taking statin, take CoQ10 with it. Uh, but you can easily avoid. There is a studies published also when people eat healthy, nutritious diet with lots of vegetables, nuts, and seeds, and good oils. Their blood pressure, sorry, their cholesterol drops in as soon as in 2 weeks. Two
Mm.
weeks makes take big shift. So, but what we are eating today is not right. The food is all very tainted with a lot of chemicals, pesticide, insecticide, and
Right.
on top of it, we have so highest level of glycophosphate, which is a
Mm.
roundup in our food. It causing a lot of problem. I think we are learning it, but still we are not stopping use of it in our on our crops, and is sprayed on everything which needs to be dried very quickly so that they can be harvested. So we are actually doing something very wrong.
Yeah. Yeah, you definitely answer the question on how prevalent the heart disease is. And like you said, 4 or 5 different blood pressure medications you've seen some patients, which
Oh,
is
yeah.
unbelievable because, if one doesn't work, they stack on another two on top of that. Plus, then there's side effects that can come from all those. So, and we're just here giving general information here today. We're not telling you, oh, stop your blood pressure medication, stop your statin today just because you heard Dr. Dan and Dr. Sodhi here today on the podcast. But we want to at least show you what options are out there, some other options, right? So, what are some of the biggest risk factors for heart disease besides blood pressure, Dr. Sodhi? What might surprise people about these risks? What should they be looking out for?
So one interesting thing is like the metabolic syndrome. We
Yeah.
are all getting pear shaped. We if you look at these pictures of us or our families in the 1960s and 70s, we were all slender. There was no rounded in the center, the pear shaping. And we all are getting there because we sit too much,
Yeah.
and the food habits change. We are become socioeconomically more richer, and sugar, which was very minimal, carbs, which were very minimal in our diet previously, and the refined carb. I'm not talking about carbs, the good carbs. I'm talking about refined carbs. So
Yeah.
if you go, I guess, anywhere you go, this is all those white breads and sandwiches and pasta. They all are the cause of that metabolic syndrome. And when I check the insulin level of these people, the fasting insulin will be 25 to 30 to
Yeah.
40. Some people have 60, and no doctor is ever checking. That's one thing. And this tells me even we can see the disease coming in 10, 20 years later when you check the insulin level, because it's okay. Now you're okay, your A1C is 5.6, 0.7. I said, oh yeah, when you become diabetic, come to me. So unfortunately, when you have diabetes, chances of your heart disease increases fourfold.
Yeah.
That is the worst thing which you can do for you.
Wow.
Any sugar which is excessive than your body can handle will crystallize, and it becomes like a glass, ground glass in your blood vessels. So it does a very havoc on your blood vessels. That's why the number one cause of blindness in diabetics, number one cause of kidney failure, number one cause of amputation, because of all that glass like sugar, which makes your blood vessels completely fibrosed and you cause the disease. So we have a very interesting thing which is going on in our society. And interestingly, I think Dr. Rijan, you know that 50% people who get heart attack does not have high cholesterol. their
Yeah.
their blood
Yeah.
vessels are clean. And so there are other factors which we need to look at it. Inflammation is one of the biggest cause of heart disease, and there are a very nice and sensitive marker which is called C-reactive protein cardiac, which can be measured. When you have a high level of it, 60% more heart attacks in you, 60. And there is another lipoprotein which is called lipoprotein A, small a. And if you have, this is a genetic defect, some people are born with it, they have extra 60% chances of getting heart attack.
Yeah.
So if you're not looking for those factors, and then you also want to look at apolipo B.
Yeah.
So these are small particle of the lipoprotein, which is your fat basically, and they can slick underneath the blood vessels and cause the fibrosis in that area. And then the cholesterol comes and makes a surrounded to help to heal it, but then it causes fibrosis and atheroma, and it's slowly progressing you towards the heart attack.
Very good breakdown. And what do you like the fasting insulin to be? I'm just curious.
Four
What do
to
you
six,
for it?
four to
Perfect.
six,
Yeah, I tell
four to
people
yeah.
under 7.
Yeah,
I
and yeah,
like
yeah, four
ideally.
to six is my normal. Seven will be okay, but usually people who like, you can just look at the waistline and see which is
100%.
insulin level is going to be.
Yeah,
If you have flat,
you can guess
your
it.
tummy, you have more high. And actually, it's funny that I'm working on my insulin level too. Mine was 10, and I have dropped my carbohydrate completely right now. Just trying to reverse it and add a lot more vegetables in my diet and eating good healthy oils, and I already see change in my waistline.
Isn't it interesting the range is 2 to 25, the reference range, but anything
Yeah,
above 10, 11, it's too much, right?
too
It should
much
be a tighter.
exactly. Yeah, yeah. You're not consuming your sugar the way the body should consume it and store it, because the purpose of body is to store, and the number one source of our glycogen storage is our liver. But if you look at, because of our so much toxic environment and toxic food, the liver has a fatty deposition in it, which is called non-alcoholic fatty liver disease,
Yeah.
and very common. Is actually almost everybody out there has that these days. So we need to reverse it. And so if your liver is not storing, the next store is your muscle, but you have to do exercise for that. If you don't, because all your muscle is basically glycogen. And
Yeah.
then if you don't do those glycogen storage in your muscle because you're not exercising, then it's going to go to triglyceride, three molecules of sugar combined to glycogen to make it the fat. And that's what collects around your waistline, on the thigh, back of your neck, and all over the skin. And interestingly, if you have a visceral fat, which is worse fat than the subcutaneous fat. So a lot of people, if they do the scan of the body, what they found, their organs are completely wrapped with a lot of this fat.
Yeah.
It's choking your organs. So your organs are not functioning at the best of their health.
And then the body has to send out more insulin
Which
because
exactly,
you're insulin resistant, right? We want to
exactly,
be insulin sensitive. It can't get
exactly,
through all the fat there and coating
exactly.
the organs.
That's right. So it's
Very,
not
very
able to store
interesting.
it. Yep.
So, how does Ayurveda and naturopathic medicine address heart health? What are some things you use clinically over the last couple decades to help with this silent killer, we call it? Why, by the way, why is it called silent killer?
Okay, so the because what happened is because people don't get checked out, people don't go, and they have some pathology in their blood vessels, and people die suddenly. There's people who are sleeping and they will die. That's why it's called silent heart killer. The silent heart attack they get, and majority, a lot of people, around almost 50% can get silent heart attack,
Yeah.
which is a huge. So what I tell anybody who has a family history needs to be start checking early by 30. And unfortunately, now the heart disease is also happening at early
Yeah.
30. Okay, I've seen many patients. By 40, if you don't have heart history in your family, still get checked out. What I like is a one simple test called calcium scoring. You get your CAT scan of your heart, And I don't recommend it every day, but you do every 5 years. And if you have calcium deposits, there's something bad news. Although it's not the worst news, but it's a bad news. Then you check your markers. See how is your C-reactive protein, how is your lipoprotein is, how your apolipoB. Cholesterol has been beaten to death, but it's not the real cause of the disease. Like people who are centenarian, people who live longer, their LDL level is more higher. So these people live longer. LDL is actually the low density lipoprotein is like a truck which carries all the nutrition of the body and distribute all over the body. And that actually is the way that we should be doing it. So LDL is not a bad thing. And there are two different kind of molecules of LDL too. Well, there are many, but we can, for the discussion's sake, we can make two right now. So one is a bigger fluffy molecule which does not cause any problem. When there's a small dense molecule which causes a problem. And that's why we should measure apolipoB. And we have supplements, we have herbs, and one of the best supplement for that is amla, by the way. Amla helps
Okay.
remarkably. Amla also helps with lipoprotein A, and amla is present in many different products. Trifle has the amla in it. Amlaplex, which is another jam type of stuff, has amla in it. And there is a studies published on that, by the way, to help that process. And you can also use anti-inflammatory herbs like curcumin. We have a
Oh,
very amazing product called CoCurcumin, which is a combination of curcumin bound to medium chain triglyceride of the coconut, and it actually helps the body to absorb more because curcumin, as it is, has a very low absorption, 0.06%. So you're not absorbing anything. But
yeah.
it's good for the gut. If you have gut inflammation, then it stays in your gut. It can be really good for Crohn's disease, ulcerative colitis, or even gastritis, or you have a gastric ulcers because the medicine is going to stay in that area. So curcumin can be good for those conditions. But if you want to get it out of the system, you need some other mechanism. So that's why I designed to bind it to the MCT, medium chain triglycerides of the curcumin of the sorry coconut, and
Oh,
now it become lipophilic. You will see your inflammation markers cut down very, very nicely. The other
wow.
day, I will tell you a very interesting story. Patient came to me. He's a carpenter, and he has a big bump on his elbow and a red swollen heart. So, and he knows that he has gotten staph infection in the past, and the staph infection MRSA can be very dangerous, and he is in acute pain. The pain level from within half an hour started from 1, went to 10 in half an hour. And so I did the blood test,
Wow.
and CBC was high. So my doubt was that is this MRSA, and so he said, but I don't want to take antibiotic. I said, okay, fine. I'll give you this curcumin preparation. Give him. You take one every hour, one
Every hour.
teaspoon, and let me know by the end of this day how you're feeling. And by the end of the day, he sent me email of his arm, and the also say, okay, I'm feeling better, not the best, but feeling better. My pain. And then next morning he sent me again. So I'm doing great. My fear is gone off MRSA,
Wow.
and I'm feeling better. So just one day, otherwise, if it was in the regular facility, he will be getting IV
Yeah.
antibiotic for it, and not getting the best result. So again, if you look at it, I did not even attempt to target the infection. I attempt to target the inflammation.
Right.
And when the inflammation was down, his body was getting remarkably good. We also gave him
Makes
Neem Plus,
sense.
which has a amazing properties of dealing with the different kind of bacteria and viruses and fungus. It's funny that Neem works on so many different levels. It is antiviral, antifungal, antibacterial, and the antibiotic property of Neem is like 1,000 times diluted than any antibiotic. But what it does, it immune modulation. So it's not going to machine gun effect. Okay, kill it, but it does your immune modulation, and your body become ready to
Right.
accept it and become better with the infections.
100%. Imagine if you have so much inflammation, it's like your body's on fire. Your immune system can't work properly, and the
No.
healing nutrients can't come heal his elbow properly if he's so inflamed. So you cut the inflammation down, the immune system can then relax, respond properly, right?
Yeah, body actually. That's what my main intention about my book is free medicine, your body and natural pharmacy.
Yeah.
Body does everything on demand, but you need to provide the proper kind of care for it, and also need to believe in it. Because if you don't believe in the system, then you are doomed. Because then you fearful. Oh my God, something bad is going to happen me. And that's what I make these people in charge. Okay, you have my cell phone number. You text me. You send your picture, and I'm with you. I will give you antibiotic if you need it. If you don't need it, we don't need it. And that way, I think a lot of people has, I have a history of these kind of infections coming to my patient, the clinic, and getting better with it.
So you mentioned neem, you mentioned curcumin, you mentioned amla as well. Those are all three that can apply to the heart as well, the
Exactly.
cardiovascular system, blood pressure,
Exactly.
correct?
Yes, and the Ayurvedic charm for heart is Arjuna, Terminalia
Oh,
Arjuna.
okay.
We have product called Arjuna Heart. So very interesting study published about Arjuna. So they took the heart failure patient. So there is a scale which is called New York Heart Association scale. I think it's a and these patients were class 4 heart failure. And when the Arjuna was given to them, within 3 months they converted from class 4 to class 1.
Uh-huh.
So really very, very effective helping. So what it does, it actually does the cross-linking of the fibers of the heart, makes it more stronger and flexible.
Yeah.
The flexibility of the heart is very healthy, and the more flexible heart is, the more better it is, because the pumping thing, if you have a pumping thing, it becomes harder, then you have a problem. And that's exactly what happens in heart attack. Your blood vessels become harder and they break open with the heart getting the under stress. And there can be other mechanism too. A lot of people has the coagulation and they clot and they get heart attack. But again, the CoCurcumin is amazing product for that too. I have seen so many patients with the amazing results with it. So if you
Yeah.
see this formula, this is the Terminalia Arjuna in it, maximum. Then we have the Annular Racemosa, which is called Alicampain. There is also lots of study published on Alicampain and heart disease, by the way. It reverses angina, both Terminalia Arjuna and Annular Racemosa. There's the published data available. And magnesium is amazing, which you all know. Small amount of coral powder to help. The coral in Ayurvedic medicine is used as a heart tonic. And
Interesting.
B6, which we are used pyridoxal 5-phosphate, more bioavailable form of vitamin B6, and methylfolate. And because a lot of people has methionine, sorry, what I'm trying to say here is homocysteine,
Homocysteine,
this
yeah.
homocysteine disorder, and that we are trying to target that here too. And when we target that, we results are amazingly, and it also has a CoQ10 in it. So we have very nice soup, very nice cofactor, very nice nutrient for the heart to flourish and get balanced and nourish.
Yeah.
This is used in Ayurvedic medicine as a tonic, so we can use it regularly without getting too much side effect. There is actually no side effects with Arjuna. I've not seen any.
Yeah, we might even need to do a part two, Dr. Sodhi, of heart health because we're just, I feel like, just getting warmed up here. We still haven't talked about the CoCurcumin. I haven't pulled that up, but this is a great start here from Ayush Herbs. We have the Arjuna heart formula. And now folks can see why we love having Dr. Sodhi and his brother, Dr. Shailender Sodhi, as well, because they blend both naturopathic and Ayurvedic herbs together into formulas better than anybody I've seen do it with herbs like Terminalia and Elecampane. I'm sure no one's really heard of Indian Elecampane used in heart formula. So very clean formula, and it's specific. That's what I like about it. It's not just a whole kind of B vitamins, a B complex. Very specific ones chosen for the heart. And there's, of course, CoQ10 in there. It's funny, Dr. Sodhi, now they're doing pharmaceutical commercials for CoQ10. Have you seen
Yes.
those? Because of how
Yep.
many people are on statins, now the
Exactly.
conventional doctors are starting to prescribe CoQ10. Why is
Exactly.
CoQ10 so important for the heart?
Because when you take a statin drug, it leaches your CoQ10, and
Yeah.
CoQ10 is a vitamin for the heart. It is makes the heart very, very versatile. Very again, I think the contraction and relaxation is the function of heart. And when you have statin drugs, your CoQ10 depletes, and you don't
Yeah.
get that contraction proper and relaxation. So it becomes a wonderful heart tonic, CoQ10, for the everybody. And I take it regularly. I'm 67 years old. I want to be active and stay healthy until I die. I think the health, the what I am coming to, the absence of a disease and presence of your faculties and its normal functionality, your
Yeah.
sense of smell, your sense of touch, your eyes, your taste, and your mobility, and your cognitive behavior should be functioning until we die. And that is the main purpose of human life on this earth, to stay cognitive, functional until we die. And Ayurvedic principles are talked about for centuries. And again, you have to work for it. There's no freebies. You have to exercise, you have to do stretching,
Yeah.
you have to do meditation, calm down. We are too much revved up in things which does not give us anything. And let that garbage go. Be fresh like a child, be happy all the time. Child will be crying one moment and next moment he will be happy that
Yeah.
nothing happened. So let's, learn from a child too, that how to let go things and try to be balanced in our lives.
And we're doing one last screen share here for today's episode, episode 195 here with Dr. Virender Sodhi. We have the CoCurcumin that you just mentioned a few moments ago, and this has CoQ10 in it as well.
Exactly.
Just like in this one here, the Arjuna
more
heart
higher
formula.
dose. Yes, exactly.
This formula does have a higher dose of CoQ10, correct?
Yes.
Yeah.
And
then, yeah, go ahead.
Yeah, the beauty is more bioavailable. So people talk about black pepper and long pepper and ginger, or black pepper, mostly piperine, but it has the three peppers, long pepper, black pepper, and ginger extract in it to help it more bioavailable. Plus, it binds onto the fat of the medium chain triglyceride of coconut and make it more lipophilic.
Yeah.
And that is the beauty about this formula.
Phenomenal. We can talk about this for 2 hours, my friend. I haven't seen long pepper in a formula in a long time, if ever. It's usually just the black pepper and the ginger with the turmeric. So you added in a second type of pepper because at the end of the day, turmeric is a spice, correct, Dr.
Yes.
Sodhi? So it works even better absorption if you combine it with other spices. Is that a good way to look at it?
Actually, if you look at the studies, this formula is called Trikatu, the black pepper, long pepper, and ginger. It
Really?
enhances the absorption of many drugs. In one of them is your rifampicin, which is the anti-tuberculosis drug, and enhances the absorption of your B vitamins. So it is really a magic thing for a lot of things. And the mechanism is what it does. It dilates the villi in your intestine. It stays this medicine stays longer there, so the absorption area increases. So really, it's amazing that how the traditional use of these spices has amazing effect, and even we're finding out so truthful even today.
Amazing, my friend. So that brings us to the end of our segment. I wish we can keep going here. I feel like we're just getting a good start. The addition of ginger, pepper, and long pepper also acts to enhance absorption as well as improve digestive comfort because of their piperine content in this formula, the CoCurcumin by Ayush Herbs. It looks like it's in a glass bottle. This comes as a powder. I love powders, Dr. Sodhi, because if you look at the other ingredients, none.
Yeah.
So powders tend to be extremely pure. No other fillers are needed to be added. And you can get a much stronger dose in powders because there's no other fillers that it doesn't have to be encapsulated in tablets, right?
Yes. Plus, also we switching to glass bottles because plastic, release. We are finding out, we all go the bandwagon and then realize, oh my God, this is not the right choice. It is expensive and it is a little difficult to ship. But we have been so lucky. Almost all preparations which are pasty like Amlaplex, CoCurcumin powder, we are now in glass bottles.
Amazing, Dr. Sodhi. Thank you for your time today. Where's a good place people can learn more? AyushHerbs.com or
AyushHerbs.com, AyurvedicScience.com. So these are our websites, AyurvedicScience.com and AyushHerbs.com. We actually going to also talk to Dr. Keenan today. We will be doing more podcasts like you doing it. And the purpose is to educate people. Health is not a pill. Health is not a supplement. Health is them. And they need to learn right kind of nutrition, right kind of exercise, right kind of breathing exercises, stress reduction, and then taking some supplement will help you live longer.
Oh, that's a no-brainer for you guys to add the podcast. I'm always here available. If you need me as a guest, I would love to come on. And
wonderful.
I think you guys would have an amazing podcast. So today we covered all kinds of different things like risk factors to look out for with heart disease, family history, You mentioned blood parameters that you should be checking, like lipo A, apolipoprotein B, fasting insulin, not just the typical lipid panel that most doctors check. CRP, you mentioned the high sensitivity version, homocysteine, and then we even hit on Arjuna heart, CoCurcumin, why it's called the silent killer. So this was a very good use of half an hour. Thank you always, Dr. Sodhi, for coming on. Always
Welcome.
appreciate
Thank
you.
you. Thank you. Bye.